He has been on antibiotics for 10 years every day straight because he had something with, I think she said it was a shoulder replacement that had a bacterial infection. So his doctor's answer was put him on antibiotics for life every day, a high dose. Well, back to your video, right, with the antibiotic resistance, the amount of Enterobacter groupings that he had that were overgrown, and those are antibiotic resistant bacteria. I pulled the video up today actually to show her again that antibiotic resistance, how it kind of comes in, and it was E. coli on that slide, which is the Enterobacter grouping. So he was like the living culture of the Enterobacter groupings being antibiotic resistant, watching it in live oral microbiome space. It's crazy.
Whoa.
Ew.
Yeah. Like pretty much every one of the Enterobacter groups that I've seen, he had in his test results at high levels. And so that once again, we were talking about how do you approach the physician and say, do you think that this is wise at this point, 10 years of antibiotic use? What are you creating as far as a petri dish of antibiotic resistant bacteria? I can tell you, we can give you a salivary test.
That's crazy. You're blowing my mind with that right now, right? Like I find that like, no, it's not okay. Like like anybody worth their salt is going to go, hold on, especially everything that we know now in 2026. I feel like I second guess everything. This is not on topic, but I did want to ask since this is on my mind. Do you think like for a case like that, well, two things are going through my mind at once. One, that is kind of crazy. Like there needs to be a lot more studies done on if the number one treatment is throwing certain things into cyst-like form. And I mean, they admit more studies need to be done, but then get to studying because I agree, they do.
Yeah.
And let's start talking about other ways to treat it as well, which brings me back to ozone. So I know you're familiar with that too. I don't know if everybody else is. On patients like that, like I just yesterday had my first ozone what is it? The autohemus where they take out your blood, they ozonate it and put it back. Could something like that have benefited him? Do you think like, I don't know enough about the blood version of ozone, to be honest with you. Do you know anything about that? Like could that?
I mean, I think it's a good alternative. I think maybe even ozone tablets might be a good option versus like an antibiotic. The problem with some of the Enterobacter groupings is they're facultative. So I feel like some of the facultative, although there are research articles and that is technically a facultative article, and I can do that.
Heather, you're cutting out.
Okay.
Oh, I thought it was just me. Okay. I was
Oh,
like,
no,
I
yeah.
can't.
Heather, say that one more time. What
Okay.
you just said, the scent. Yeah.
So yeast is facultative and ozone is effective against yeast, according to many research articles. That the Enterobacter groupings are also facultative. So sometimes it's a little bit trickier on whether that ozone is actually going to be effective because they can also utilize the ozone. So it gets a little bit tricky with those Enterobacters on whether or not ozone alone would help or not. I've had really good luck. And I had another case this week too that I want to put together because I showed them this guy's case, but he had Klebsiella. Here, let me hit my hotspot up for a sec.
It was classic, and then it was like ... Let this hang in.
Right. It was like,
yeah, I know. Like, where's my popcorn?
Yeah, Klebsiella, I think 45 or 50% relative abundance of that one species, and I put him on a regimen. Beautiful. I was like, can I just use this to show how effective this care plan was for you? The only problem is he didn't come off the biocidin and the essential oil, and his nitric oxide levels were low, but the rest looks beautiful. So I was like, let's come off that. And but he gave me permission. I'm going to take all of his data and I'll do a case study for you so you can see the treatment that I put in and what the after results were. So, but yes, I think it'd be a better option to try something like ozone in the bloodstream, especially if we're worried about implant failure, because many of the implants or even the cardiac are part of that Hackett group, which are gram negative and anaerobes. So then ozone would be effective against strepmidis. Right, Holly?
Yeah, I think too, you know, I mean, you're talking about 10 years of antibiotics. It's not just the oral,
Crazy.
it's your whole
Yep.
microbiome, your whole, and
Your
if you
gut.
keep,
Yeah.
yeah, if you keep thinking like paying homage to like the whole body microbiome, your skin,
Yep.
the gut, your mouth, the vagina, all the whole body.
Yep.
You're just the resistome.
Yep.
You know, I mean, if we are driven by bacteria, you know, bacteria in our gut are telling our brain to do things or telling us we're hungry or not, and you wipe out that ability to have that communication, what is going on? How is he functioning?
Well, I mean, he's got a slew of autoimmune disorders like diabetes and
Yeah.
yeah.
So, Kristen, I wrote down the care that you deserve. That guy is not getting the care that he deserves.